Hello everyone, my name is Dr. Vandana Ramanathan. I'm a fertility specialist with GarbhaGudi IVF Center, Marathali branch. So today I'm going to be talking to you about when are donor gametes, that is donor eggs or donor sperms, recommended for couples with fertility issues. There are certain indications where we recommending donor eggs or donor sperms depending on the case. So most often than not, couples are told to go for IVF cycles using their own gametes, that is their own eggs and sperms. But there are a few conditions where we have to, counsel the couple to go for donor gametes. Now, what are these conditions? So coming to the female part first. So in case the lady is having something called as poor ovarian reserve, where her ovaries are, not functioning that well and they have very less number of eggs. So in these cases, we tell her that, she may need to go for donor eggs. Second is if the lady is aged. So for example, if she's crossed 35 to 40 years of age, when she's around her 40s. Now why do we say that? Two reasons. One is along with age, definitely her egg reserve comes down. So the number of eggs that she will be having are less. Second is that the quality of the eggs also start dropping after 35. So after 35, say when they're closer to 40, the egg quality will be very poor and the outcome of the IVF cycle will also be affected because of that. So this is another condition where we tell the lady to go for donor eggs. Third is when a couple has had repeated IVF failures. So, when we go through the history, whether they have done it outside or with us, if they've had repeated, say, 3-4 cycles of IVF failures, we will review the reason why they have failed. And, if we see that it's because of a poor egg quality, we recommend these couples to go for donor eggs so that the egg quality could be improved when it's a donor egg. Next is when the lady or there is a family history or the lady herself has some genetic abnormality which can be passed on to her child. So in these cases, if the couple is more concerned about, not passing on these genetic issues to their children, we recommend that they go for donor egg. Now coming to the male side, when do we recommend donor sperms? So first and foremost is we recommend donor sperms in men who have a condition called azoospermia, where there are no sperms in the semen sample. Second is when they do have sperms but the sperm numbers are very less or the sperm quality is very poor. So if the numbers are less or the motility is very poor or the quality is very poor. So what is less, anywhere, something like count like 1 to 2 million sperm counts or even less than that. Or if the morphology, that is the quality of the sperm is less than 1%, we recommend them to go for donor sperms. Third is when, similar to the female factor, if the male has a history of any genetic abnormalities or a family history of genetic disorders that could be passed on to the child, very concerned about that and they don't want that to happen, then we recommend them to go for a donor sperm. So these are the most common conditions where we advise couples to go for donor gametes. Of course, whether you have to go for donor gametes or not will depend on your history, your other tests and parameters, and this decision will be taken by your doctor after consulting you and after you are convinced that you require a donor gamete. If you still have any queries, please feel free to drop your questions in the comment box and we will answer them. Thank you.